Doctors of Reddit, what's the most awkward experience you've had with a patient during a regular checkup? A doctor, so nothing is really a regular checkup, but I was interviewing a fairly attractive young lady about a pelvic complaint, and she answers all of my questions quite comfortably with some guy in the room. I hand her a gown so she can change for the pelvic exam, and she says, "Can you ask this guy to leave first? He just followed me in here from Tridge. Last time I neglected to establish the relationship of all the people in the room." Never thought about this. Every time my SO's been with me, the doc would ask who he was in relation to me. Good to know that they're looking out for ya. Okay, this isn't particularly awkward, but I love this story, and I was there and saw it firsthand. Before I got into medical school, I worked as an orderly in an ER. At the time, the university hospital was getting all the good trauma and we were relegated to the routine stuff, and that offended some of the younger and more enthusiastic nurses. One day an old guy came into the Tridge office. That's the first room you walk into in the ER to be evaluated, and the nurse asked him what his chief complaint was. He answered, "I was shot," and she leaped into action. Calls out on the intercom overhead something about a trauma code and she needs a stretcher stat. Everyone comes running, throws this guy on stretcher and racing to the trauma room. She is in full TV nurse mode, starts cutting off his shirt and yells, "Sir, where were you shot?" And he yells back, "In Korea." We all look at each other and slowly come to a halt in hallway, and everyone turns to the nurse, who is looking quite sheepish. The old guy looks around and continues, "And now, my knee hurts when it's going to rain." On second thought, it was quite an awkward moment for the nurse. If you didn't get that off Scrubs or something, that's freaking funny. I hope it's true. I'm going to tell myself it is. I'm a dental hygienist. Back when I first started cleaning teeth a few years ago, I had a client who came in to get her teeth cleaned. She was the sweetest little old lady with tons of energy and was full of life. I got her comfortably seated in the chair, leaned her back, and started scaling away, dental term for removing plaque tartar or bringing the pain. Halfway through the act, my stomach starts to grumble. She pokes fun at me for it and we both have a laugh. Minutes later, the grumblies in my stomach make their way down to my butt, and it takes everything I have not to fart with this sweet lady's head between my legs. It's no use. I figure that if it's going to force its way out, I might as well make it a silent one. I straighten up my posture and lean ever so slightly towards my tray of instruments to swap for a new one. I must have miscalculated or something, because what was supposed to be a silent fart turned out to be one of those toots that sounds like Mario jumping from the original Super Mario Bros. The granny looked at me with a look that was one part bewilderment, another part amusement, and the last I'm not even sure, maybe pity. All she said was, "There you go, dear. Now I don't feel so bad for letting a few go myself out in the waiting room." Needless to say, she has always been my favorite client to this day. Gave a girl a pelvic exam at a free clinic. She was my waitress the next evening. She was my age, which made it even a little more awkward, somehow. Did you ever see that episode of Fawlty Towers where Basil is serving some Germans and doesn't want to mention World War II? I felt like that the whole evening, like at some point I was just going to say, "I'll have the steak tartare and a side of French fries." While working in the ED, a very attractive female in her mid-20s came in, her boyfriend complaining of abdominal pain. Part of the workup requires a pelvic exam and bimanual exam. Girl in stirrups, 2 fingers in as deep as possible to feel the cervix. I offered to have a female perform the exam, but she said it was okay if I did. A chaperone was present, but her boyfriend demanded to watch as well. He stood across the foot of the bed from me and started me in the eyes with a scowl the entire time my hand was deep inside his girlfriend. Made for a very uncomfortable situation for all. After the exam he pulled me aside and told me he thought she was in pain because he fricked her harder than ever the night before. I have no idea why he felt the need to say that, but I assume it was because he was trying to prove something. I had to remove a plastic soda bottle off a guy's dong that got stuck while fapping in it. Yes, apparently it's a thing. After using ring cutters without success, I was able to pry the top off with pliers. Unfortunately, I was standing right in the like of fire and got pee on. That's what I'm telling myself. I yelled, "Mother sucker," and the guy just laughed and said, "I guess I won't be doing that again." Some people are super lonely. My great uncle had a practice with another doctor, Dr. Snow. Dr. Snow had a son who had some form of intellectual disability. The way the story has been passed down the family, he was an imbecile, which is an awesome word but terribly politically incorrect. Anyway, one day Dr. Snow was seeing some patients and his son, aged in his mid-20s, was hanging round the practice. Dr. Snow went off to do something, and in the meantime his son decided to play doctors. He put on the white coat and opened the door, and the next patient came in, a pregnant woman. He asked her to undress and turned his back. When he turned back, he looked her up and down and said, "What? No dong." The woman ran screaming out one door and he ran screaming out another. This is my favorite story in this thread. Regular checkup with a patient I've seen at least 3 times prior. Normal conversation at this point. Then he starts talking about gangs that have been coming by his house. Reaches into his bag to pull out the things left behind by the gangs. Takes out crumbled pieces of drywall, specks of paper, a child's eraser. Goes on about the things the gangs have been doing in his house. Very graphic depictions of physical and sexual assaults by gangsters that are varied in color. Green, blue, orange, not race. Starts having visual hallucinations in the office of a big red gangster that had been following him. Pulls a gun, starts waving it wildly at the red gangster. I stop breathing. He puts the gun away. I write or send an electronic message to my nurse. Get security. Gun in bag. Meanwhile I keep him talking about something benign. Grandkids blah blah. Knock at door and 3 cops tackle him. After a week admission to psych, he was better, medicated, and didn't really remember the situation. No charges or anything. I'm just happy he was treated and is better. Psychotic breaks happen all the time. The most important part is supporting the person because they're probably absolutely terrified. Sure, other things have happened in clinic that might be viewed as awkward, but really aren't that awkward given that they are coming to the doctor for help. Most people have a vagina or penis, and sometimes our bodies play tricks on us and do things without our approval. One of my professors tends to tell this story a lot. Of course he leaves out major identity factors. So apparently he was giving a routine exam to an 18-year-old girl who was about to go off to college. Before the exam began, he noted that she had a very athletic build, healthy complexion, and was very good looking. After viewing her medical charts, he notices she is not on birth control. Since she is rather pretty and about to go off to college, he asks her about it. Apparently this 18-year-old girl had never actually had a period. When growing up and going through puberty, she visited other doctors who told her to keep waiting because her body fat percentage was too low to have periods. My professor had a WTF moment, so he asks her if she would like to have a pelvic exam. Once he opens up her vagina, he discovers a nub. He then realizes that she is a he. This beautiful 18-year-old girl was actually born a boy with high amounts of estrogen and had inverted genitalia. So instead of breaking the news of, "Hey, you're actually not a girl, you're a guy and you need to have your penis and testicles surgically removed because they could turn into cancer and you probably shouldn't go to college right now," he referred her to another more sensitive female doctor. I remember this one patient. She was in labor and I had to check her cervical dilation. Now the way that's done is by doing a digital vaginal exam and estimating the gap with the index and middle fingers in a V shape. Most of the time this is pretty routine, and TBH, the patient is usually too distressed by the contractions to care. This one last, however, seemed to respond to my examination in a totally unexpected way. She went from ouch to MHMM. Needless to say, it took me all I had to keep a straight face. Took me a while to figure out that a digital vagina exam does not involve electronics. A nurse once told my father she would be coming back to give him a shot. He removed his pants completely and sat on the exam table. She was very confused when she returned but still gave my dad his shot in his shoulder. I did that. She never left the room, just turned round to get the needle, giving me perfect time to expose my pale Irish ass. "This is for your shoulder. I know, I just thought you wanted to see it." She was gorgeous. I was mortified, but she laughed and the tetanus jab worked. I was once checking stitches on a patient's leg who was wearing a skirt and going commando. She sneezed and peed on me. I stood up and in an effort to alleviate the tension, she gave an awkward grin and said softly, "I guess I did have to go." I left without a word and got cleaned up before telling her doctor she was ready for her. But I have other patient stories if there's interest. Generally the main question that hospital staff get asked are what's the weirdest thing you've found in someone during an x-ray. Well, this one old fella came into the ward via an ambulance and clearly didn't need an x-ray. He had a broomstick handle inserted in his ass. Usually when questioned, people come up with loads of excuses about this sort of thing. But when asked what happened, the old guy's reply was as follows. Well, I was riding the crap of this out of this broomstick, holding onto the washing machine for support, but when I came, my knee gave out, I slipped and it went right up in me. I tried to pull it out but could reach round to grab it with both hands, so thought it best to come to you guys seeing as you've got to sort my knee out anyway. At my hospital, the weirdest x-ray in recent memory was a suicide patient that swallowed a dozen 9mm bullets. You're doing it wrong. I went in to get a rectal exam once and the doctor came in and told me to turn on my side, and as I was doing so he was putting on the gloves. Then all of a sudden I hear a loud pop followed by "Sigh, why do we only have the small gloves here?" Needless to say, I was absolutely terrified. My friend is a doctor and had a job at a university medical center. One day a 18 or 19-year-old guy comes in, nervously asking for a STD check. My friend asks him the usual questions. Had unprotected sex? Number. Sex with people from Dominican Republic, Africa? Number. Sex with stranger? S. Number. How often? When was the last time you've had sex? Never. Dot. Never. Never. I'm a virgin. Have you engaged in oral sex? Yes. When was the last time? This morning. Do you know the person? Yes, it was me. I guess that explains the virginity. I am the son of a surgeon. I went with my dad to see an elderly patient who needed a cast. I was 9 and we were going to an assisted IVing facility to take off this lady's cast, as she couldn't make it into the hospital. He had a little saw, which was loud, but he touched it while it was on to show her it wasn't going to cut her. Upon him touching the saw to the cast, she starts screaming bloody murder. He's cutting my arm off. I was scared but he pressed on. When we got in the car to go home, he burst out laughing, saying it was just hilarious. I wasn't as amused. Not a doctor, but had a real awkward experience with one. Got a hernia when lifting a gate, so they had to ultrasound on my balls. The doctor was a female and when she put the gel on my balls I said that feels weird. She stops immediately and says, did you just say that feels good? I was like, no, weird. It feels weird. Worst awkward silence of my life followed. Friend was doing residency in Atlanta several years ago. A morbidly obese, middle-aged African American woman came in for a checkup at the clinic he was working at. During a routine breast examination, he shifted her breast and a slice of Wonder Bread that had been wedged into her folds fell onto the floor. He quietly moved on to the next breast, respectfully ignoring the bread, until a second piece of soggy, white Wonder Bread fell onto the floor. Unable to bite his tongue any longer, he looks at the woman, who doesn't seem to think that anything strange has happened, and says, "Ma'am, were you aware that you had 2 slices of bread lodged beneath your breast?" Her response, "Boy, you know I be sweetin'. They shouldn't have gone bankrupt then. 1 product, 2 markets." You have been visited by the doggo of good times. For good times increase, comment with cheers doggo. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.